Hello, my name is Sarah, and I will be presenting a roundtable discussion on the transition from a registered nurse to a master's level prepared nurse. The agenda for today is to discuss the significance of a master's degree in the field of nursing, reflect on how it can significantly impact patient care, and how this transition has affected my own practice. I would like to start with a case example. An 89-year-old female presents to a medical surgical floor for sepsis of unknown origin. Her temperature upon admission to the floor is 99.8 degrees Fahrenheit. Her breathing is unlabored and 18 respirations per minute. Her heart rate is 80 beats per minute. She does have body aches with a pain rating of 7 out of 10. Her white blood cells are at 11,000. Her lactic acid is 3.8. This patient has a surgical history of cholecystectomy, hernia repair, and a cesarean section. She has had a past medical history of Raynaud's, hyperlipidemia, hypertension, and recurring urinary tract infections. Her urinalysis revealed moderate red blood cells, moderate white blood cells. Her urine is nitrate positive, and she has moderate ketones. Her culture was a mixed growth of 100,000. She has been living in an assisted living facility for the past 2 years after her husband passed away. This patient had been given IV fluoroquinolones in the ER prior to admission to the medical surgical floor. The patient's fever has reduced and repeat blood work is trending to normal. However, this patient still is complaining of lower pelvic pain and asks for warm and cold packs for her perineum. As the MSN prepared nurse investigated this patient's pain in more detail, she noticed that the patient was requesting the heat and the cold packs for her perineum every couple of hours during the day. So, in terms of the science of nursing, this nurse is going to assess the perineum to determine the cause for the discomfort. The perineum does appear erythematous and has a purulent green tinge drainage, and that is coming from the vaginal canal. For the art of nursing, after discussing these findings with the patient, she becomes tearful. The nurse ensures she is safe to talk to and holds the patient's hand. The patient states that she has not had her pessary cleaned since her husband passed away. She was too embarrassed to ask for help from medical staff and was unable to remove it herself. To give a little bit more detail, this was a situation that I did come across, and a prolapse requiring pessary was not in her history. However, you can see some of the warning signs, risk factors for needing a pessary, and we'll talk about that in the next slide here. So we're going to talk a little bit more about the art versus the science of nursing. The art of nursing, the nurse provided this holistic care, including discussing her husband's passing, addressing a fear to ask for help, and inquired further about the patient's pain, despite the fact that on paper she was improving. She provided appropriate touch, including hand holding, to comfort the patient and build trust. So, as stated in OGEN, which is a subgroup of ANA, the art of nursing includes compassionate care, communication, and caring of the whole person. You're not just looking at one aspect of health, being lab values or pain rating, as much as you're looking at the whole person, making sure their body, their mind, and their spirit is healthy. Now, to move to the science of nursing, we happen to know that one of the leading causes of recurring UTIs in postmenopausal women is low estrogen levels of the vagina and perineum. Low estrogen levels can also cause depletion of that vaginal tissue and can lead to prolapse. Perineal pain requiring constant ice and heat is not normal for any age group. Previous nurses that to me, they were caring for this patient and they were giving the ice and the heat, which is great. That's a great therapy for pain, but that should have triggered, oh, there's something wrong here. There's something that we're not understanding about this patient's experience. So knowing what's normal and what's not normal. The patient had a surgical history of a cesarean section, and that is a major risk factor for pelvic organ prolapse. And you can see my in-text citations on the screen here. So, why is it important for MSN? How does this background facilitate this higher level of care? Master's educated nurse focuses on evidence-based practice. We can initiate quality improvement projects, and we can study methods of leadership and communication. So not only will this aid the identification of patient situations such as these, but the master's level nurse can initiate a root cause analysis and determine how this patient's pessary was missed and how to prevent this for future patients. Whether that becomes an intake question for patients of certain age groups or with certain risk factors. The impact of my master's education on my ethical worldview. So there are many perspectives to be had regarding bioethics, including virtue ethics, natural law, deontology, ethics of care, and utilitarianism. And you can read that in our master's textbook. I've also read relevant research and reflected on the perspective of minority and underserved groups in my community. So the way that my master's program has prepared me has been thinking of situations that are outside my experiences. So I know that I tend to think in more of a deontology, bioethics worldview, but by studying, I can understand that maybe natural law has some benefit to it, especially in the group of people who are really trying to be all natural and move away from medication management. That maybe there's some value to it, or I can try to see the perspective of somebody in a minority group that through a lens that I previously hadn't considered. So by doing this, I have a more complex understanding to make ethical and patient-centered decisions in my practice. Here are my references in case you are curious and would like to do your own research. Thank you very much for seeing my presentation, and I hope you have a wonderful rest of your day.